All right, my name is Alisa Kvåle. I'm a Vice Dean of Research and I'm also a professor in physiotherapy. I'm very pleased to say hello and welcome to, in Norwegian, it's HVL, or in English, Western Norway University of Applied Sciences. Just a few words of introduction from me as well. Why is evidence-based research of importance to healthcare? I guess you all know a few of the answers, but just to go into that. But first, what am I representing? This particular faculty where Hans and I are employed, it's the Health and Social Sciences faculty. We have around 5,000 students and close to 400 staff, 25 professors, and then we have part-time professors, 69 associate professors, and then we have senior lecturers and quite a few of the college teachers, which is a challenge because you come from different educational institutions, and you might have fewer of the number of being college teachers and more of the professors. So our ambition is to make sure that the lower level education have the skills typical of being a researcher. In this faculty we have 20 or 19 research groups. We have in the areas we have that we typically do research on is health promotion and coping, contextual conditions for health function and participation, physical activity type of studies of health and function and participation, and implementation of research and intervention studies where Hans is quite central, and we had educational research. These areas you can find here on the line. It looks like it doesn't show quite well, but you see we have these areas of research here, and these are the educational programs that we offer. It's nursing, it's physiotherapy, we have sport and public health, we have evidence-based practice in health sciences, we have occupational therapy, radiography, we have social work, health management, mental health, and we have education in social education and child welfare and social education. So we have a number of bachelor and master's program, and across these educational programs we have different research group trying to base their education as research-based as possible. Well, do we have this knowledge? Can we offer updated knowledge? Hopefully, but lack of knowledge, if we have lack of updated knowledge in healthcare, this can lead to great variation in clinical practice. There is a disagreement of what best practice is, and this can reduce the cooperation between health care practitioners. If we lack knowledge in healthcare, controversial treatment methods survives, and patients can be offered, still quite often offered, treatments that do more harm than good, and they cost money, waste of money. Public health services should not waste time and money on method that does not work. So the principle of evidence-based research and practice is to have the best available knowledge concerning why a treatment works and how it works. Clinical expertise has to be taken into account in order to identify each individual patient's unique health status and diagnosis, their risk, and use of potential interventions. And we should also have the ability to acknowledge and get to know what is the patient's preferences and his or her values, and these three elements or these three principles should be integrated. So why is evidence-based research of importance? This is the topics that you're gonna go further into these days. But the basic questions are, what do we know? What do we lack knowledge of? And when is new research warranted? Redundant clinical research has been published due to absent use of systematic reviews when research is in the planning phase. This is, as you've said in your program, this is unethical. It limits the available funding for important and relevant research and diminishes the public's trust in research. So in this process of building up evidence-based research and evidence-based practice, you will meet, or we will all meet challenges. The challenges between both research and practice is, I guess you can call it the research clinician gap. So the clinician must have access to and evaluate research results, not the results that you as researchers have. The clinician's own belief and challenges and habits can be challenged. And the clinician must acknowledge their own biases, and the clinician must take time and effort to change outdated beliefs in their patients and to make time and effort to empower the patient to participate in this particular process. In evidence-based medicine research practice, the researcher-clinician gap must be reduced. Evidence-based research must become a skill, a basic skill in our health education, in all these programs that were listed initially here. Educators must teach how to seek or prepare and use systematic reviews, and when those who are newly educated go into clinical work, they bring their research with them in and make also not only the research as updated as possible, but also the practice as updated as possible. An educated student is better equipped for meeting this increasing demand of updated knowledge and new method in clinical practice. When user and patients are involved, we have this shared decision-making process, and informed patients are better patients and might reduce also the waste further. Finally, evidence-based research is necessary in order to provide good and safe health and social services. Evidence-based research requires resources and collaboration across borders. It's necessary that not only here in this particular university or your particular university, but that we work across borders in order to meet these challenges in research and in practice. International collaboration is necessary in order to shorten and minimize this gap between research and practice, and in order to enable implementation of updated knowledge, and in particular to avoid unnecessary research, to avoid waste. So these are some of the things that you will go into depth of this week or these days. And as you saw on the first picture, that was this campuses, and this is a tiny picture of this town that will be sunny, I think, tomorrow or Wednesday, so you will see it in sunshine as well, I hope. I hope you will enjoy these days here and that you will have a very pleasant conference or workshop. Good luck.